Welcome to the American Nurses Association quick video on COVID-19 vaccine booster shots. I'm Kendra McMillan, registered nurse and senior policy advisor in ANA's Department of Nursing Practice and Work Environment. Today, I will cover 8 things you need to know about the COVID-19 vaccine booster for you and the communities you serve. Why are COVID-19 vaccine boosters necessary? COVID-19 vaccines work and continue to reduce the risk of severe disease, hospitalization, and death. However, ongoing research among vaccine recipients shows protection against the virus that causes COVID-19 may decrease over time. A booster dose for vaccine recipients can help to enhance immunity and protection against COVID-19. Who's eligible for a COVID-19 booster? Eligibility for a booster dose depends upon the type of vaccine received and the timing it was administered. Pfizer and Moderna vaccine recipients are eligible for a single booster dose at least 6 months after completion of the primary dose series. Eligible groups include individuals aged 65 and older, individuals aged 18 and older at high risk of severe COVID-19, and individuals aged 18 years and older with frequent institutional or occupational exposure to SARS-CoV-2. All J&J vaccine recipients age 18 years and older are eligible for a single booster dose at least 2 months after completion of the primary dose series. Where are COVID-19 vaccine booster doses administered? Jurisdictional planning for booster doses has differed from the initial rollout of COVID-19 vaccines. Check your local pharmacy's website to see if vaccination appointments or walk-ins are available. State and local health departments also have information on availability, access, and vaccination sites. Other options include searching national resources such as vaccines.gov, texting your zip code to 438829, or calling the number on the screen for COVID-19 vaccine administration sites in your community. Can I mix and match COVID-19 vaccine booster doses? Yes. The Food and Drug Administration amended the emergency use authorizations of each available COVID-19 vaccine to allow for mix and match administration of booster doses in eligible individuals following completion of primary vaccination. What about booster doses for adolescents? Can I administer those? Data on boosters for adolescents and teens aged 12 to 17 is not yet available. Boosters are currently recommended for adults age 18 and older who fall within specific eligibility categories based upon risk. How do you become a provider of COVID-19 vaccines? COVID-19 vaccines are administered by healthcare professionals enrolled as vaccination providers through a health practice or organization. Contact your health system administrator about your health system's enrollment eligibility. Scan the QR code on the screen to visit the CDC's COVID-19 vaccine provider enrollment page for eligibility and enrollment criteria. You can also volunteer through your local Medical Reserve Corps to support vaccination programs in your community. How can I educate my patients? Ask about vaccination status during healthcare visits and inform of eligibility of booster doses if indicated by the medical profile or known exposure risk category. Have educational materials in multiple languages to appropriately educate all patients, and have local and national vaccine locator resources readily available to share with your patient. If working in an office or a community administration site, you can use your secure messaging services such as email or text to notify patients of availability of COVID-19 boosters. For patients who do not use email or text messaging, have staff call patients. And remember to also remind patients that vaccines and boosters are free, safe, and effective. Is it safe to administer flu shots and COVID-19 vaccines at the same visit? Yes. Influenza season has started, and flu shots help prevent the spread of the flu. It is safe to administer the flu shot and COVID-19 vaccine during the same visit. If co-administering the influenza and COVID-19 vaccine, administer each injection in a different injection site. Scan the QR code on the screen to watch an educational webinar on the 2021-2022 influenza vaccination recommendations and guidance on co-administration with COVID-19 vaccines. For more information about COVID-19 vaccines, visit ANA's COVID-19 Resource Center at www.nursingworld.org.